Okay.
Good evening, everyone, and thank you for joining us for our Breast Health Basics program. My name is Michelle Schlieben, and I am an RN for Northwestern Medicine, Kishwaukee Hospital. And my background has been in maternal child health as well as women's health. And I'm excited to present this program to you tonight. We're going to mostly talk about prevention. And so I'm hoping that in this program, since it is a breast health basics program, that some of this information you've heard, but I also hope that you learned some new information as well. So let's kind of talk about some objectives. The first thing we're going to talk about is some statistics of breast cancer. We're going to also talk about just some screening guidelines and some myths and facts regarding breast cancer, some average breast cancer risk factors, and then how we can impact those risk factors. So the first thing we're going to talk about is what is breast cancer? Breast cancer really is just like any other cancer. It's unregulated cell growth in the breast, and it can start in one breast or it can be in both breasts. Most frequently, it is diagnosed in women aged 50 or older. So this is why it's so important that we kind of talk about these breast cancer early, and we have conversations. Actually, I feel like it should start at adolescence. We should be talking about this with our children and kind of teaching them what to look for, what may increase their risk, and just kind of increase the awareness of this topic. So the next slide is going to show you what is normal. So we all hear about breast cancer, but what is normal in our breast, or what are some things maybe that are abnormal? So in this slide, you can see that it talks about how the skin, the fatty tissue, the milk ducts, the nipple, the areola, all of those things are obviously normal. And then on the left-hand side, it shows little lymph nodes. And so if you're feeling around in your breast and you're doing a self-assessment, if you feel something that feels like soft beans, that is a lymph node. If you feel something like a soft pea, that is a milk lobe. And then if you feel something hard, that is often a sign of a cancerous lump. So I like to use this because it kind of it puts it in perspective. We all have lumps and bumps in our breasts, but kind of identifying how it feels. Is it movable? Because a cancerous lump or a hard, it often feels like a lemon seed. If it's not movable, that's a sign of cancer. So it's important to know these things just so that when you're doing your self assessment, you can kind of look at, what is your normal? And if you have changes and you notice a cancerous lump or something hard, you can have that looked at by your doctor. This slide is also from knowyourlemons.org, which I love this website. And it just talks about, so what does breast cancer look like? We talked about what it might feel like a little bit, but let's talk about what it might look like. So a thick area on the breast, a dimple, maybe some nipple crusting. It could be red or hot. It might have some fluid that is like a discharge kind of, some skin sores, maybe a bump, a growing vein. So if it's veining is good in the breast, it usually means good things. But if you have a vein that is continuing to grow and you're noticing it's getting larger, that's something you want to pay attention to. A sunken nipple, a new shape or size, orange peel skin, or like we talked about before, a hard lump. So these are some things to kind of look and kind of feel and see. If you notice these things, you might want to talk to your doctor. So we're going to talk about the statistics, some things you should know. So breast cancer is one of the most commonly diagnosed cancers among American women, second only to skin cancer. And for women in the US, breast cancer death rates are higher than those for any other cancer besides lung cancer. Men can also develop breast cancer, and not everyone realizes this. So it's important that we're also educating our young boys and young men about this. It's often not diagnosed until like age 60 or 70, and it only makes up 1% of all breast cancer cases, but it can occur. And so it's important that we educate ourselves on this topic. A woman's risk of breast cancer can actually double if she has a first-degree relative. So that would be a mother or a sister or a daughter who has been diagnosed with breast cancer. And sometimes there are known gene mutations that are inherited from one's mother or father, and that makes about 5 to 10% of all breast cancer cases. So you may have heard of BRCA1 or BRCA2. Those are gene mutations. And so someone who maybe was diagnosed with breast cancer or maybe even ovarian cancer, they may do a test to see if you have those gene mutations. And then if you do, that can kind of guide the doctor as well as yourself on like the care for your daughter, or maybe just your risk factors. So I won't go into great detail on that because I'm not an oncology nurse, but I just want you to be aware of what a gene mutation is, and that would be like a BRCA1 or BRCA2. Less than 15% of women who get breast cancer have a family member diagnosed with it. And this is really important that we focus on this, because 85% of breast cancer cases occur in women who have no family history of breast cancer. And often I feel like women are lulled into thinking because they don't have any family history, they don't have a risk, but unfortunately they do. And so, it's just, I think sometimes we, if we think it's not in our family, we don't have to worry about it. But unfortunately with breast cancer, 85% of cases are in women with no family history. So how common is breast cancer? 1 in 8 women, so that's about 13%, will develop invasive breast cancer over the course of their lifetime. And 1 in 39 women will actually die of breast cancer. So I know that that is not a positive statistic. However, when you look at it in another way, 7 in 8 women are not going to end up with invasive breast cancer. So I think it's important to think about that. But, there is a risk. And so, 1 in 8 women, like that's quite a bit, that's a big risk, it's one too many, right? So how do we prevent, or what do we do to kind of, make sure that we're doing everything we can so that, number 1, we don't end up with breast cancer, or number 2, we get diagnosed early, right? So this is a comparison of breast cancer screening guidelines for women with average risk. And you can see the American College of Obstetrics and Gynecology, the American College of Radiology, the American Medical Association. All 3 of these organizations recommend starting your screenings at age 40. And so I point this out because the American Cancer Society actually recommends age 45. There's always going to be a variance, in recommendations. However, I would highly recommend that you start at age 40, because you get a baseline, and then each year that you have your mammogram, they compare that to the previous year. So the more you have, the greater chance of catching something early. So now we're going to talk about mammograms. So mammograms are the most important tool available to not only screen for breast cancer, but also to diagnose, evaluate, follow up on an individual who has been diagnosed with breast cancer. And it's the only screening exam proven to reduce breast cancer mortality. So, there's often some concerns with mammograms, and we'll go over that here pretty soon. But I just want you to know that we try our best to not let it hurt you. There's a fine line between the amount of pressure that we have to use to get a good picture, because it's basically like an X-ray. And so we have to put a firm pressure down on the breast, but we also want to make sure you're comfortable. So there's a fine line there, but we really do try to make it so that it's comfortable for you. And like I said, it really is just an X-ray. But I think one of the common questions is, does it hurt if you haven't had one before? And we'll talk about some of these concerns here. So we talked about, do mammograms hurt? Well, they can hurt, right? But everyone's different. We all have different pain tolerances. We all have different breast tissue. And so it's really hard to say, do they hurt or not? But like I said, we try to balance that pressure that we put on the breast, as well as the comfort level for the patient. Sometimes it's a little harder in women who might have dense breasts, which dense breasts means they're more tightly packed. So if they're tightly packed, it's harder to get a good picture. So sometimes we might have to do a couple different views, or maybe press just a little firmer, just to make sure that we get a good picture. And that's important because often with women with dense breasts, dense breasts does not cause cancer. However, we often find that sometimes we find something later because of those dense breasts. So we might not catch it as early. So mammograms really have came a long way over the years. And I think one of the things is just how the mammograms are done. So they're not as scary as they used to be. Another common concern is radiation. So do I have radiation? What is the risk there? Again, we've come a long way, so there's not as much radiation exposure with the machines that we use today. And the dose isn't zero, but it is very low. It's less than what we are exposed to just from background radiation in a year. And so this should not deter you from getting a mammogram. And then, do mammograms find too many harmless cancers and miss too many other cancers? So mammograms do find some cancers that may never spread, but this is less than 10% of all cancers found on a mammogram. So again, shouldn't deter you. So this next slide, I love this video. It's actually a video from our very own Dr. Velez, and she's going to talk about breast self-awareness, knowing your lumps and bumps. So the important thing that I want you to get out of this presentation or this video is that you need to know your own lumps and bumps, and you should be doing your self assessment at the same time every month, and you should do it every month. So it should be a regular thing that you do. But I will let you listen to the expert. Here we go.
Hi, I'm Vanessa Herkert, and today we're going to talk about breast health. Breast health is important to everyone, especially people like me that have a predisposition to breast cancer because of the BRCA2 genetic mutation. I'm so happy to have Dr. Velez here with me today to get me started on how to do a self-breast assessment. Is that the right way to talk about it?
That is a much better way to talk about it than historically when we've been discussing breast exams. We want women to be comfortable, and we want them to get to know what their breasts feel like without feeling like there is a great deal of pressure to perform an exam.
And now Dr. Velez is going to walk me through this process and answer all my questions.
So when you're doing a breast self-awareness session, okay, for example, what you want to start doing is you want to first just look. You want to look for asymmetries in the breasts, one size being larger than the other, for example. You want to look at skin changes. You want to look for dimpling. You want to look for any sort of puckering of the skin. You want to look at the nipple to see if it appears flattened or inverted. One of the maneuvers that might actually be helpful in doing that would accentuate some of those findings, would be to lift your hands up above your head and press your arms together, or to put your arms at your waist and push down. These are movements that make the muscles change or tightened and can sometimes accentuate some of those findings. So step number 2 is going to be to feel. You want to start up by the clavicle, and then you want to gently feel from the periphery towards the nipple. When you're doing the feeling, you also want to make sure that you feel with the pads of your finger, the first 3 fingers on your hand, and you want to use the opposite hand to the breast while you're feeling. And you want to use light pressure, you want to use moderate pressure, and you want to use firm pressure all the way around the breast. And once you do it on one side, then you do the same thing to the other side. As part of the exam, you also do want to feel up into the axilla or the armpit on both sides, because some of the breast tissue does extend up into that general region.
I almost missed my armpit.
You may have lumps or bumps. Many women do, but they're your lumps and bumps, and really the important thing is to get to know where those are so that you can identify changes when they occur.
Okay, so this is great, but if I see anything like this, should I call my doctor, freak out? What should I do?
Okay, no freaking out, absolutely not. So that is your first step in becoming breast aware.
Okay.
It is quite possible that that lump has been there for quite some time. It is quite possible that that lump is a lump that fluctuates with your periods and your hormones, but there's no reason to be too scared right away. These are common findings, and most of them are going to be benign.
Do you think my physician is going to think I'm crazy or a worrywart for calling with the simplest questions like these or any worries.
So zero judgment. We really want all of the women to come in when they find anything that they feel has changed in their breast exam or something they're concerned about. There is absolutely no reason to live in fear, and not knowing sometimes can be very, very stressful for people. So it is okay to just come on in and have a very good discussion with your physician. This is your body. You need to know your body. It is going to be a long relationship. You have a long time to get to know them, and you have to start.
It sounds like what's most important is to make it a habit.
That is, in fact, the most important thing. You want to make sure that you do your exam frequently. You want to do it consistently the same way, and you will get very good at knowing your own breasts.
My way is to feel it on the first. This is my monthly reminder at the beginning of each month to do my self-breast awareness.
That works great. However, you can feel free to do it anytime you want, and the best time is going to be about a week after your period.
Thank you so much for being with me today to teach me and share your expertise, not only with me, but with all of our followers, and how to be breast self-aware.
Thank you so much for having me. And if you want to schedule an appointment with your physician, don't forget to visit nm.org.
Okay, so just a recap of the video. Know your lumps and bumps, and same time every month. And if you find something that's not normal for you, then contact your doctor. Okay, so now we're going to talk about some myths and facts about breast cancer. And so we're going to first talk about some myths. So antiperspirants and deodorants cause breast cancer. There has been so many rumors that antiperspirants or deodorants cause breast cancer, but there is no scientific evidence that this is true. So that is a myth. Healthy cancer-free breasts are not lumpy. Well, unfortunately, we all have lumps and bumps. All breasts are lumpy. So that is also a myth. That's why it's so important that you know your own lumps and bumps, so that if you notice a change, you can notify your doctor and have things looked at. Wearing a bra can cause breast cancer. There's no evidence, again, that a bra can cause breast cancer either. And if a woman bruises her breast, it can turn into breast cancer. So a bruise on the breast is not going to turn into breast cancer. Cancer is, again, kind of what we mentioned before. It's just basically abnormal cell growth, right? So whoops, I didn't mean to do that. Sorry, guys. So cancer is not, that's a myth. You cannot get cancer from a bruise on the breast. And some facts that we're going to talk about. So screening tests can help women find breast cancer early. Well, we do know that breast cancer, when it's found earlier in the stages, it is much more easier to manage it. So that is a fact. Breast cancer is easier to treat if you find it early. We know that. And a woman is at risk for developing breast cancer even if no one in her family has had it. And we touched on that a little bit earlier too. Remember, 85% of women with breast cancer do not have a family history of breast cancer. Okay, so breast cancer risk factors. The number one risk factor for breast cancer is actually being female. So this is unfortunate because we can't change that, right? We just are female. So, I'm going to go into some depth here about why. So the items on the left of the screen are things we cannot control. The items on the right are things that we have some control over. So being female, we don't have a whole lot of control over. And the reason why is, so women's breast development takes about 3 to 4 years to complete. And it's usually complete by age 14. And once breasts are fully formed, breast cells are very immature and they're highly active until a woman's first pregnancy. So while they are immature, they're very sensitive to estrogen and other hormones. They're very responsive to those. And so this can make them more vulnerable to unregulated cell growth. And so then therefore it increases our cancer risk. Age is another factor. So we know that as we age, our risk for cancer increases. And so Women are more likely to get breast cancer as we get older. 2 out of 3 women with invasive breast cancer are between the ages of 55 and 64. And so the longer we live, there are more opportunities for the genetic damage or the mutations that occur. And so as we age, then our bodies are less capable of actually repairing that genetic damage. So the risk for breast cancer increases. And then the next one is menstrual history. And so I'm going to go over this a little bit. So estrogen is a hormone that is made in our body, and it helps the body develop and maintain the female sex characteristics. So being exposed to estrogen over a long time can increase the risk of breast cancer. And the estrogen levels are usually the highest during the years a woman is menstruating. So the following reproductive factors increase the length of time that a woman's breast tissue is exposed to estrogen. And I'm going to go over these reproductive factors. The first thing is early menstruation. So if an individual starts her period before the age of 12, she is exposed to estrogen for a longer period. So that causes her to be more at risk for breast cancer. Starting menopause at a later age also puts the individual at risk for breast cancer because she has been exposed to estrogen for a longer period. And then older age at birth of the first child or never having given birth can also increase your risk, because when we're pregnant, we don't menstruate. So therefore, pregnancy lowers a woman's lifetime number of menstrual cycles, so that we have less estrogen. So the breast tissue is exposed to more estrogen for longer periods of time in women who maybe have never had a baby. So that increases the risk of breast cancer. And also, if a mom has a baby after the age of 30, that also increases the risk because, again, more exposure to estrogen. So just to recap that, women who start menstruating younger than age 12 have a higher risk of breast cancer later in life. And the same is true for a woman who goes through menopause later in life. So I just want to I know that's a lot of words there, so I just wanted to kind of recap that. And then the next thing is family history. So we talked about family history a little bit, and family history does affect, if we have a first degree relative who has had cancer, then yes, we have a higher risk factor. But again, we can't control that. So these are things that we don't have control over. So some things that we do have some control over is pregnancy. So if you never get pregnant, well, then you actually have an increased risk, because remember we talked about before, we have the highest risk when we're menstruating because of the estrogen that is present. So when you're pregnant, you don't have a period. So therefore you have a decrease in the amount of estrogen that you're exposed to. And then if a woman breastfeeds, she also has a decreased risk, because again, when you breastfeed if you're exclusively breastfeeding, you actually don't have often you don't have your period. And so you don't have the estrogen exposure. And it is dose dependent for those who are breastfeeding. So the longer you breastfeed, it decreases your risk. Being overweight actually is also a risk factor. So maintaining a healthy weight is really important. And the reason why it's an increased risk if you're overweight is because the fat cells make estrogen. And so the extra fat cells mean extra estrogen. And when the breast cells are exposed to that extra estrogen over time, the risk of developing breast cancer is higher. So that is why being overweight is a risk factor and why we want to try to manage that as we can. Lack of exercise, also a risk factor. It plays a role in also most likely your weight. And just the amount of activity is really important to kind of you want to be active. You want to be out and moving. And the research does show a link between exercising regularly at a moderate or intense level and a lower risk of breast cancer. And current recommendations are about 150 minutes or a moderate activity, or 75 minutes of strenuous activity per week. Drinking alcohol. is also a risk factor. So, often we hear, oh, wine is great. It's okay to drink wine. Unfortunately, research consistently shows that drinking alcoholic beverages, beer, wine, liquor, increases a woman's risk of breast cancer. And compared to women who don't drink at all women who have, who have had 3 alcoholic drinks in a week have a 15% higher risk of breast cancer than those who do not drink. So the bottom line is regularly drinking alcohol. It doesn't matter if you are binge drinking or getting drunk, like even if you're just having 3 drinks a week, you still have the same risk. So that 15% higher risk if you're drinking for breast cancer. And then smoking, we know smoking can cause breast cancer as well. And it also causes a number of diseases. It's linked to a higher risk of breast cancer in younger premenopausal women. There's scientific evidence on that. And then smoking can also increase complications from breast cancer treatment because you don't heal as well after surgery and breast reconstruction. And then there's higher risk of blood clots if you smoke. And we're going to move on now to some protective factors to reduce your risk. So we've talked about a healthy diet. We've talked about exercise. And these are all important things to reduce our risk. And I think that the thing you want to know about reducing your risk is that risk is dynamic and it can change over time. So you need to understand the importance of lifestyle and health decisions that can influence your risk factors of developing cancer. So even small amounts of movement or just maybe a walk or going, doing yoga, anything is better than nothing. And I want you to remember that. You don't have to go to a gym and sweat for an hour. Just you need to have some movement. So the one thing I want to talk about on this slide that I haven't touched on is the Know Your Lemons. So this is a website, and I referred to it earlier in the presentation, but I recommend you visit this website. It's a great website. It really kind of makes it simple and easy to understand or easy to explain to someone else if someone has questions. But this is a great website because they have an app that you can actually download, and I think it reminds you every month of when you can do your self-assessment. It also, their mission is just to improve early detection for breast cancer. So I just wanted to point that out in case you have questions and maybe I didn't touch on something. They have a lot of information there too. And then last but not least, I want to touch on this because we want everyone to get mammograms. We want everyone to get or have breast self exams as well as a mammogram. And so this slide talks about, for DeKalb County at least, women who are ages 40 to 64 and are uninsured or and they don't have any insurance. I'm sorry, they're uninsured or they're insured with no screening coverage. They're residents of DeKalb County, they can actually receive one or both of these exams, or breast exam or mammogram. So you can call this number that's listed on the screen. And if you don't live in DeKalb County, the Illinois Department of Public Health, they established in 1995 the Illinois Breast and Cervical Cancer Program, and they also offer free mammograms, breast exams, pelvic exams, and Pap tests to eligible women. So if you live in Illinois, you don't have any insurance, you're 35 to 64 years of age, and some women may be eligible if they're younger in certain cases. But you can contact the Women's Health Line and they can get you set up and walk you through eligibility requirements and the screening process, and you can actually receive a free screening. So I wanted to share that as well. And actually, that is all I have. That is the end of our presentation. So thank you so much for letting me share this information, and I'm opening that up for questions now. Thank you so much.